So hello everyone, welcome to my new video. So today I will discuss with you all about band-shaped keratopathy. Okay, so from this word keratopathy, what is mean by that? So keratopathy means disease of cornea. Okay, so that is known as keratopathy. Now band-shaped keratopathy means there is a band-like structure is forming on the cornea. That is an abnormality due to many reasons that we are going to discuss in this video. So this condition is a very common eye abnormality that we see in our day-to-day OPD practice. So this band-shaped keratopathy is one of the corneal degeneration. Okay, so this band-shaped keratopathy is a corneal degeneration which is mostly due to the deposition of the calcium on the cornea in a band manner in the palpebral fissure, that means 3 to 9 o'clock, which is exposed part. Okay, so here the calcium deposition only limited to the subepithelium, Bowman membrane and anterior stroma. So initially the band start from the periphery, that is 3 o'clock, and then it go to the central, and then in the nasal it start from the 9 o'clock and then it go to the central. So first it appear in periphery, then in nasal, then these two go in the central manner. Okay, so that is band shaped keratopathy. Now what is the etiology for that? So this band shaped keratopathy can be idiopathic, that means the cause is quite unknown, but there is other systemic causes also that can lead to band shaped keratopathy. Okay, so first of all, the first cause, imbalance of calcium and phosphate in the body, can lead to band shaped keratopathy. Now chronic renal disease, there is kidney disease, chronic renal disease can lead to band shaped keratopathy. Now it is also seen that those patients who are having juvenile idiopathic arthritis and it lead to uveitis for long period of time, those patients also seen to have band shaped keratopathy. Now alkalosis, uh, on the surface of the cornea. So what is alkalosis? Is the excessive nature of alkaline. So in the surface of the cornea can also lead to band shaped keratopathy. Now it also can be due to keratoconjunctivitis sicca, leading to evaporative dry eye, and due to that it can lead to band-shaped keratopathy. Now any cause of uveitis can cause band-shaped keratopathy, as I told you earlier. Now endothelium damage due to corneal edema can also lead to band-shaped keratopathy. Patient who underwent VR surgery, that is vitreoretinal surgery, and where silicone oil insertion was done, and the eye left aphakic for a long period of time, those patients also can develop band-shaped keratopathy. Now in-stage glaucoma or neurotropic keratitis, all these conditions can also lead to band-shaped keratopathy. Now there are signs. Before going to the signs, I would like to tell you that the band have numerous pores where the nerve ending pass through, where you can see the pores also there here, right? So the formation of band lead to irregular surface of the epithelium, which sometimes lead to epidefect. So that's why the patient may complain you that he is having very much ocular pain, something because of the irregularity and constant blinking. It lead to epidefect in some time. Okay, now this band keratopathy usually do not cause significant vision loss until the central vision or the visual axis is affected. Then it is not leading to any type of significant vision loss. Okay, now calcium deposition that happen over the cornea is same as the calcium found in teeth and bones. Okay, so here initially the deposition start at the epithelium basement membrane and reach to the Bowman membrane, and also it can reach to anterior stroma depending on how much long period of time the person having band-shaped keratopathy or what is the severity of that. Now these are the signs where you will see gray white band deposit on the palpebral fissure at 3 to 9 o'clock meridian. Now extreme periphery of the cornea is will be quite clear because of the limbal vessels. Now here the minute holes on the white plaque also there. Why? Because of the nerve endings. Okay, so these nerve endings can penetrate the calcium deposits. Okay, now symptoms what the patient will complain you: reduced vision if central portion is affected, Patient also can complain that foreign body sensation, redness, occasional redness can be there, photophobia, cosmetic appearance is not good, so that's why the patient came to you. So here, this type of complaints the patient can give you. Okay, so how to diagnose? Yes, it is a band-shaped keratopathy or not. So here, take the proper history from the patient. As I told you in etiology part about the different causes that can lead to band-shaped keratopathy. Ask about the systemic diseases, ocular disease, take the history properly. Okay, then do the slit lamp examination nicely to the patient to see whether it is band-shaped keratopathy or something else. Okay, and if it is band-shaped keratopathy, you will see a white band will be there in 3 to 9 o'clock meridian. Okay, so here history taking, so you should give special attention to history taking. History is a key point in the diagnosis of band-shaped keratopathy. You should take medical history properly, where you need to ask the patient about the systemic illness, any previous medication, any ongoing treatment, something this type of questions. You also can ask to the patient about the previous ocular injury, like in the past the patient had any ocular injury or not. That also can lead to band-shaped keratopathy. That's why you need to ask to the patient. Also ask about the previous ocular illness. Okay, like if the patient had prolonged uveitis or prolonged HSV infection. As I told you in etiology, neurotropic keratitis, there is a complication of HSV infection, but it also can lead to band-shaped keratopathy or prolonged dry eye. So this type of ocular condition can lead to band-shaped keratopathy. So that's why you need to ask the patient about the previous ocular conditions. Okay, and also do prefer to ask to the patient about the history of taking calcium supplement. Okay, because why? Band-shaped keratopathy is the deposition of calcium on the cornea. So if the person have hypercalcemia, then also the patient may develop band-shaped keratopathy, because the calcium can do the deposition on the cornea also. So it can be a reason. So that's why I do prefer to the ask to the patient about the is he taking any calcium supplement or not, something. Okay, so here, why only deposition at the horizontal meridian? Because the horizontally, so here the pigments that we see, the calcium deposits most often seen in the palpebral fissure, as it is quite more exposed to ambient air. But in severe cases, superior portion of the cornea and inferior can get affected, but in normally or mostly band-shaped keratopathy is seen in the horizontal palpebral fissure area. Okay, now this is the investigations you need to send to the patient, where you need to send to the patient about the serum calcium, serum phosphate, uric acid, creatinine, chest X-ray. Why chest X-ray? Suppose you were suspecting that the patient may had any systemic disorder like sarcoidosis or tuberculosis that can lead to uveitis, or complication is band-shaped keratopathy. So that's why you can send the patient for chest X-ray also. And also do prefer to send the patient for serum calcium, serum phosphate, to see the level of calcium in the body, something. Okay, now differential diagnosis. So differential diagnosis, here two diagnoses I selected here. One is spheroidal degeneration. So in spheroidal degeneration of the cornea, you will see homogeneous, translucent, fine golden yellow globule dot like structure in the cornea. But band-shaped keratopathy is white gray band structure. There is no yellowness is seen, only there is grayish band is there. That is the calcium deposition. But this spheroidal degeneration is a proteinaceous deposition. Why? If someone exposed to sun for a prolonged period of time, like UV radiation, because of these changes, this kind of protein get deposited on the cornea. So it is leading to spheroidal degeneration. Okay, but band-shaped keratopathy is due to some systemic disorder where there is deposition of the calcium. So it is quite different. Okay, now let's go to the interstitial keratitis. So it is a type of corneal ulcer where there is no involvement of the epithelium, but you will see infiltrates in the stromal area, leading to patient have ocular pain, watering, photophobia, foreign body sensation. So it is not limited to only palpebral fissure. It can happen in any area of the cornea. Okay, as also this interstitial keratitis can be due to after effect of HSV infection, but band-shaped keratopathy is a deposition of the calcium. So this interstitial keratitis patient will complain you like pain, ocular pain, photophobia, foreign body sensation, blurring of vision, something. But if the patient has band-shaped keratopathy, he will not complain you ocular pain until there is epi defect. If there is no epi defect, the patient is very normal, but the patient will come to you for cosmetic reason, that cosmetically it is not good, that's why deposit on the eye, that is, so that's why people are telling me that it's not looking good something, so that's why I need a solution for that. It can be a reason. Otherwise, if band covering the visual axis, it is leading to decrease of vision, so that's why the patient came to you that I'm having the dimness of vision in my right eye or left eye, so that's why I need one treatment, so that's why treat it. So there is numerous treatments are there depending on the stage of the band-shaped keratopathy. Okay, so what is the management? If the central vision is not affected, only you can see the band is there at temporal 3 o'clock or 9 o'clock, then you don't need to give any type of surgical treatment, something like that, until the patient came for solution for the cosmetic appearance, something like that. Okay, if the patient only complain you that there is whiteness is there but my vision is okay, then you can give lubricating eye drop to the patient and call the patient in 6 months or yearly. Okay, and if you see that the band is covering the visual axis, something like that, or something like that, where the visual axis is getting covered, then one process is there that is known as superficial debridement. By putting 3% EDTA is very much helpful. So when you will place 3% EDTA to the patient eye and remain it for 1 to 2 minutes and then do superficial debridement, then the calcium deposits will get go off. But if this calcium deposits remain for a chronic stages, like prolonged time, then like if it is extending to the anterior stroma, then EDTA is not that much helpful. So here you can try PTK, that is phototherapeutic keratectomy, or lamellar keratoplasty. Okay, so you will go to the surgical treatment when the patient is very much symptomatic, okay, or suffering very much. Okay, otherwise left as it is. Okay, so that's all friends, thanks for watching, and please don't forget to like my video, subscribe to my channel. Thanks for watching the video. Okay.